Yes.
Okay. Hi everyone, my name is Hitesh Tara, this is Raj Kaur and Minahanjan. So we form the clinical pharmacist team and we work on the East Warwickshire Primary Care Network and one of the surgeries is yours.
So we're making this short video today to explain a new service that your surgery is offering. It's a service called the Structured Medication Review.
So Hitesh and Raj have actually got dedicated spots for these reviews in the surgery, and I'll be doing these in care homes. And we've put together some questions to help you understand what it's all about.
So you might have heard of the term structured medication review, possibly from your friends or your family or even the surgery itself. So firstly, what's the difference between a structured medication review and a medication review? So a medication review itself is brilliant, but the structured medication review differs slightly. So what we do in a structured medication review is look at all of your medicines in more of a detailed way. We then use your most recent blood test to make sure all your monitoring has been completed. We also look at your long-term conditions as well to make sure all your monitoring has been completed for the year. And we also take this opportunity to just update some lifestyle points as well. During the review, we might find some medicines that aren't appropriate anymore. Also, we might actually find some medicines that actually need to be added, but we'll explain that in the review.
So we have been using text messages for a while now. If you have consented to the text message service, you will receive an invitation via text. If you do need a blood test or blood pressure, we will also include this in the message. Alternatively, if you've not set up a text message with the text message service, we will send you a letter.
We feel you may benefit from reviews such as this if you take more than 10 medicines or if you take medicines that require close monitoring.
So we aim to open these medication reviews to the wider patient population going forward, but we thought we'd start off by offering to those people that we feel need it most. But if you do feel as though you need a medication review, please don't hesitate to contact our reception, who will pass on your details over to us.
So the medication review itself will take between 20 to 30 minutes. During the review, we will discuss all your medications. We will discuss your concerns, your expectations, any ideas that you may have. We will also talk about any medications that are on your repeat but you're not currently taking, and any changes that we need to make to your medications. All changes are discussed with your GP, and any changes made are only made after a shared care decision with yourself.
So remember to have a list of your current medications ready, have a list of questions for us if you can, and maybe the side effects you want to discuss too. What would be really helpful is if we could have an up-to-date blood pressure reading and a pulse reading if you take blood pressure medication.
So as standard, we'll end the review with some lifestyle questions. So what we want to know is your smoking status, your alcohol consumption, so how many units you drink per week, and also your body weight as well, because all three of those together can really play a part in your long-term conditions.
All changes are discussed with your GP, and any changes made are only made after a shared care decision with yourself.
So you've had your structured medication review. So normally we do these annually with you, but sometimes we want to see our patients a bit sooner. Now, if we want to see you sooner, we will arrange that with you personally. Also, we also appreciate that 30 minutes maybe isn't enough for some people, and there are some other things that we don't have time for, but what the clinical pharmacist will do is rearrange a suitable time for you and go through all of your concerns again. So we hope these questions have been informative to you.
If there's something that we haven't covered, please contact the surgery.
And finally, we look forward to seeing you at your structured medication review.